Hi, welcome to Nurture Wellness and my 21 Days of Self-Care series, where together we're building a habit of self-care, where we do at least one thing each day to lovingly care for ourselves. Today's self-care is what I like to call balloon breathing. It's a form of diaphragmatic breathing. You don't have to remember that name. It just means our diaphragm is being engaged. We're fully expanding our abdomen as we breathe, taking a full breath in. Sometimes we form habits over time that restrict our breathing a little bit, or have tightness in our body that restricts that full breath from happening. So I like to use the analogy of air coming into our body like a balloon expanding. We want to start in a comfortable position. So even if you can be somewhere where your neck and head are really well supported, if you're lying on your back, you want to have something under your knees to support your low back. Let's get really comfortable so we can really fully take these breaths in and relax and decrease our heightened nervous systems a little bit. Let's start by breathing in through our throat like it's the opening of the balloon, then into our chest, then our rib cage, and then our lower abdomen right into the bottom of the pelvic floor. As we breathe in, we want to remember that our breath doesn't just go into the front of our body, it's three-dimensional. So as we bring that air in, we want expansion, chest, then rib cage, then abdomen in a three-dimensional way so that the air is coming into the front, sides, and back of our body. So just breathing in through the throat, letting the air fill the chest, then the rib cage, and then the lower abdomen, letting everything expand like our whole torso is a big balloon. And then we're going to release from the bottom of the balloon, which is the lower abdomen, then the middle rib cage, and then the chest. So allowing the breath to go in fully and out fully. Might take a little bit of practice if you're not used to breathing that way. In times of stress, we tend to breathe a little more shallowly. So this is a great way to just start to expand that breath. If you're in that comfortable position, as you're breathing out, you're releasing tension, you're sinking a little bit more into the surface that you're on with each out breath. And with each in breath, you're just allowing that balloon to expand without force. We're not forcing anything here. We're allowing softening and expansion to happen as we breathe in, and as we breathe out, we're releasing tension. Just continue that for as long as you're able to. 5 minutes will feel great. 15 minutes will feel even better. But just see what you can do. Give it a try. Be gentle with yourself. There's no wrong way. Really allowing that softening and expansion is a wonderful way to just be in touch with where we're holding tension. And without judgment, just allowing that area to receive more breath as it's ready, breathing the tension out, and then breathing in. And you'll notice that each time you breathe in and each time you do this exercise, you can do it every night before you go to bed. It's great for helping calm your nervous system for sleep. Anytime you feel like you need some calming, you can do this exercise. And as you continue to do it, you'll notice, okay, my balloon is expanding a little bit more evenly, more fluidly. You may notice an area that wasn't expanding as well. Maybe that was the rib cage, or maybe it was harder to get air into the bottom of the balloon in the low abdomen. Whatever that is for you, it's more about noticing than trying to change it. It will change automatically as we just allow and soften the tissue, allow tension to release. And it's a really wonderful thing to observe how your body responds. You could journal about that if you'd like to. You could comment, send me a message and let me know. I'd be curious to know. This is an exercise for me that I have used again and again over the years. I've taught to many people, and it can be a really, really wonderful tool for relaxation.